Welcome back to the channel. Today, we're tackling a topic that's both essential and controversial: the world of psychiatric diagnosis. In a time when mental health is rightly gaining attention, are we perhaps overlooking some critical concerns? Are we overdiagnosing mental disorders? And if so, what are the consequences? To fully grasp the complexities of psychiatric diagnosis, we must first look at its roots. French philosopher Michel Foucault questioned how societies define what is normal versus abnormal. He argued that psychiatry often functions as a mechanism of control rather than as a purely medical field. Meanwhile, German psychiatrist and philosopher Karl Jaspers pointed out the inherent challenges of diagnosing mental illnesses, stressing that these diagnoses can never fully encapsulate the lived experiences of patients. These philosophical questions are echoed by modern experts like Alan Francis, the lead editor of the DSM-4, who has been a vocal critic of the overdiagnosis trend. Francis argues that the pharmaceutical industry has played a significant role in shaping our understanding of mental disorders, pushing the idea that they stem from chemical imbalances and thus require chemical solutions. But is this narrative as accurate as we've been led to believe?
The gorilla in the room is the pharmaceutical industry. The drug companies spend something like $80 billion a year on marketing and lobbying. They spend much, much less on research, and most of the research they do is really a tool of marketing, not developing wonderful new products. They have become extremely expert in influencing physicians and the general public to think that there's a pill solution for every problem, that mental disorders are underdiagnosed, easy to diagnose due to a chemical imbalance, and require a chemical solution. The United States is one of only 2 countries in the entire world that allow direct-to-consumer advertising. If you watch the Super Bowl or any TV program, you're going to see drug ad after drug ad after drug ad. That doesn't happen anywhere else in the world except the United States. They control the airwaves, they control the internet, they control the print media. The drug companies have...
Francis and many others suggest that people are inherently well. The rise in mental health diagnoses, according to them, may often reflect the medicalization of normal life challenges. Feeling sad or anxious from time to time. The pharmaceutical industry might suggest you need a prescription, but is that really the case? This leads us to the heart of the issue: diagnosis. How are mental illnesses diagnosed, and why is it such a complex process? Unlike physical illnesses, which can often be identified through blood tests or imaging, mental health diagnoses are based primarily on symptoms and behavioral observations. This makes the process inherently subjective and prone to error. The difference between organic and psychological diagnoses is crucial here. Organic diagnoses are based on observable, measurable changes in the body, like a broken bone or a hormone imbalance. Psychological diagnoses, however, depend on a clinician's interpretation of a patient's thoughts, feelings, and behaviors, which can be influenced by various biases. So, why do some experts advise against rushing to a psychiatric clinic for minor symptoms? The reason is simple: not every emotional or psychological discomfort needs a medical label or treatment. Many of these experiences are part of the normal human condition. In fact, research published in the Lancet Psychiatry and JAMA Psychiatry highlights the dangers of overdiagnosis, which can lead to unnecessary medication, stigma, and a narrowed sense of self. Sometimes the best remedy is not a prescription, but rather self-care, support from loved ones, or even just time. Mental health is undeniably important, but so is our approach to it. Let's be mindful of when we truly need help and when we might just need to pause, reflect, and care for ourselves in other ways. If you found this discussion insightful, don't forget to hit the like button, subscribe for more deep dives into critical topics, and share your thoughts in the comments below. Until next time, take care and stay balanced.